This is a video of all the interior structures of the heart you need to know for the exam. So starting with the right atrium, we have the wall, which is going to consist of pectinate muscles. We have this depression right here, 55, which represents the fossa ovalis, which is a remnant of the foramen ovale, which is present in the fetal heart. So blood is diverted from the right atrium directly into the left atrium. We also have two structures here, 32. This represents the SA node or sinoatrial node, which is the pacemaker of the pacemaker of the heart. And then we have another node on the wall here, the AV node, for heart conduction. So that's what you find in the right atrium. And then as you move into the right ventricle, we have a valve. So this is going to be our tricuspid valve, also known as the right atrioventricular valve. It has chordae tendineae attached to papillary muscles. You can see the wall of the heart is not smooth. This is called trabecula carne. And we have a valve here that we can see in the pulmonary trunk. So this is called a pulmonary semilunar valve. Then we have a nice big piece of tissue, myocardium, between the two ventricles. This is called the interventricular septum. And what you can see that's part of the septum here is a bundle of conduction nodal tissue, which is called the bundle of His, or the atrioventricular bundle. And it brings the signal down to the apex of the heart, and then Purkinje fibers will bring it up to the rest of the ventricle. So this is going to be your Purkinje fibers. Alright, so as we move to the other side, there's nothing to note inside the left atrium, but the valve between the two is called your bicuspid valve, also known as your left atrioventricular valve, also known as the mitral valve. It also is the same, it has chordae tendineae, which will attach to papillary muscles. So in this left side, we can see a nice papillary muscle right here. So anything that will attach the chordae tendineae to it, it's a papillary muscle. The rest of the muscle wall, again, is just trabecula carne. In the left ventricle, we can see number 45. This is going to be a valve at the base of the aorta. So this is called the aortic semilunar valve. And this is the same, that's put together the same way as your pulmonary semilunar valve. So they have three cusps. And again, we can see the bundle of His, and then we can see the Purkinje fibers come up. And those are all the features you need to know from the interior of the heart.